Hello, everyone. Thank you so much for coming back to our podcast, Courageous Leadership with Virginia Prodan. I'm Virginia Prodan, your host. Our podcast is every Wednesday and Saturday at 10 o'clock Central Time, and we love to train you to live a life of success and significance. When you have significance in your life, you invest in people. Our podcast is on Spotify, Edify, Apple Podcast, and many other platforms. And of course, you can watch it on YouTube. We love your questions. We love your comments. And we love to bring to our podcast courageous leaders that they have done an amazing job in the area of ministry so they can encourage us and share with us what God provided for them, how they accomplish the mission, overcome obstacles, and also how they are still doing this mission. So one of these courageous leaders is Joel Noble. He is the director of public policy with Samaritan Ministries International for over 22 years. Joel, thank you so much for coming to our podcast.
Well, I appreciate you having me.
Would you introduce yourself to our viewers and our listeners?
Absolutely. So I've been with Samaritan for nearly 22 years, as you said, father of 4 boys, all the way from age 20 down to 8. So one in college, one in the middle there, about to become a driver, and one that we're still working on learning to read. So a whole range of emotions as a parent. Been married for 23 years, and just love being part of this ministry, and just love raising those boys, and just seeing what they're going to become and what they are becoming as young men.
That is so interesting what you mentioned. The fact that you have 4 kids in a range that you mentioned, and I assume they play sport, they do all kind of things. Medical coverage, it's important in your life, in your family. And you have not only knowledge of helping others, but helping your own family. Can you tell us how being in this ministry helped you and your family too?
Yeah, absolutely. So Samaritan Ministries is a healthcare sharing ministry, which means that it's not insurance. So it's direct sharing of medical needs without insurance. What that means is each month I'm assigned somebody to send to another member. I'm writing them a personal check, or I'm going through a payment system, an online payment system, similar to like Venmo or PayPal or one of those. And I'm sending my share directly to them. So when we've had medical needs over the years, I've turned those needs into the ministry. They process it, and they assign people to send to me. And so when all my 4 boys were born, I went to the hospital ahead of time. We worked out a cash pay price, and so I turned that in. Checks started coming in, and then my wife's doctor bills there, and then I cashed those checks, went and paid all my providers with that. And same way, each month I send my share to somebody, and I'm praying and sending them a note to them, helping them out. And as you can imagine, with 4 boys, it wasn't just their birth. We've stitched them up, several of them more than once, lots of stitches, no broken bones to report after 20 years. So God was gracious there.
So you mentioned a few things about how the Samaritan ministry is different than normal healthcare insurance. One, that is not an insurance. The second one is that they share, the cost. And I believe the other one will be that they members don't pay premium, and they don't file a claim. Is that correct?
Yeah. So since it's not insurance, we don't use insurance terms like premiums or claims. When they have a need, they just contact us here at the office, or they can go online and start a need there. And then we just ask for their original itemized bill so we know what the need is. And then within 30 to 60 days of when they submit it, and the difference of that time frame is just within the month when they send it. If it's closer to the beginning of a month, then it's going to be closer to 60 days for that to process. And for instance, a need that comes in May would be shared in July with our July newsletter. So if we got that need at the beginning of May, that would be in July. If we happen to get it on June 30th, or June 1st, excuse me, that would be August. So that's the difference between 30 and 60 days. But yes, we don't, have premiums or claims because we're not insurance.
So teach us, those people that are in your program are people that cannot afford insurance. They forgot to renew their insurance. What is the situation?
Yeah. So it's a wide range of members. It's many that are forced out of insurance by cost. They either find that the monthly premium that they're paying is too high, or they find a monthly premium that's just affordable, but then in insurance, their deductible is so high that it makes it actually not usable because they're paying the first, 10, 12,000 and they never get to use it. So cost is a driver. Another big driver is just freedom to be able to see the provider that you want. I mentioned, my boys and those stitches. We had to go get stitches one time in the night. They'd broken a light bulb during the day, didn't tell us. Glass was in his bed. He crawled into bed and cut his leg. So emergency room visit, middle of the night. And I had the choice as his dad, as I'm driving down Main Street, there's a hospital on the left, hospital on the right in our town. And I knew that the hospital on the right had a dedicated pediatric ER, a separate ER for kids away from adult ER on a Saturday night that was probably filled with ER visits that maybe I didn't want to expose him to. As his dad, I made the choice to turn right, go to that hospital, take him to the pediatric ER. So that freedom to be able to see any provider I want is a huge driver at Samaritan. Lastly, we don't share in certain needs that would violate most Christians' conscience. And so they know that their healthcare dollars are going towards needs that don't violate their conscience. They know exactly how to be praying for that member, and they know when they send their share, it's going towards something that doesn't violate their faith.
Oh, I believe that it's important for people to know that. You also mentioned about the fact that you negotiated with the health provider about the cost. Can you develop on that, please?
Yeah, absolutely. So since we're not insurance, and it gives us the freedom to shop around. And so our members have tools like Healthcare Blue Book, which is similar to maybe a lot of your listeners to what's called Kelly Blue Book, where you price cars. This is Healthcare Blue Book, and they can use that tool to find providers in their area that are low cost or a good cost, a fair cost, and also have high ratings. So they're able to make that choice when they're looking at needs, whether it be, an ultrasound, or if they're, going to have a knee replacement, any type of needs. They're able to look up providers in their area and find one that's gives a fair price. Also, since a lot of places will give cash pay or uninsured discounts because there's a lot less paperwork. They don't have to deal with an insurance company. They don't have to deal with claim forms. We use locally, it's just an ear, nose, and throat place. Everything is $45. And we know that because they don't take insurance. And so it's very affordable, for us. but they're able to charge that because they have one doctor, no one's processing claims forms, so they're able to keep their overhead costs down, and they can pass that on to us as uninsured patients.
So you do that and you help your members
Yes.
to negotiate and find a price and everything, and to respect their religious rights here in the United States. But what about internationally?
So internationally, since again it's not insurance, our members, a lot of them are missionaries serving overseas, and when they get treated internationally, all we ask is that they translate their bills to U.S. dollars so that we know what we're working with, and if necessary, translate it to English so that we can understand the need that we're processing. Other than that, it works exactly the same, whether it's here in the United States or in the bush, somewhere as a missionary.
Oh, that's great. Um, do you have people that have insurance, but they're not happy with their provider, and they will come and become members of your group?
Yeah, we often hear when people join that they had insurance and they just got fed up with it, whether it was the cost or it was they didn't have providers in their area, that maybe the insurance that they had kept dropping providers, and they had a doctor that they really enjoyed that they had for years, and now their insurance doesn't include that doctor, and they want to stay with that provider, and so they end up dropping their insurance. Um, it's often too that maybe they move employers, and now they have more freedom under their employer. Maybe the employer is not offering it anymore, or the employer is offering maybe to put the same amount of money in their paycheck each week and let them shop, and then they able to use that money to get something more affordable.
Give us example of few obstacles that people had and your ministry helped them.
Yeah, we're still a very insurance minded country, whether it's car insurance, health insurance, rental insurance. So there is some education that needs to go to the providers. We still have members that go into provider, and the provider doesn't know how to deal with them. And because they're so used to insurance, and they often, the first step is they want to push them right on to government aid. Oh, you don't have insurance. Let's get you government aid. Let's get you on Medicaid. Let's get you, in some kind of government service, because that's all they know to deal with the uninsured. And it takes a little bit of education on part of our members to explain, no, I don't need government aid. I'm part of this ministry. I'm going to share this with my fellow members. They're going to help me out. We found that, 20 years ago with our first son, and by the time, we were on to the fourth one, my wife's doctors were like, oh yeah, no problem at all. Just, just pay us before he's born, and we're all good to go. And so a lot of it's just educating providers.
Teach us and teach the people that might want to be members of your group. When you are talking about it's less expensive, what percentage less expensive? How less expensive is, to do your way and not, like you said, government insurance and those kind of things?
Yeah. So we have two different programs here at Samaritan, and the difference in the program is what we call initial unshareable, which just means the amount that we're asking you to bear on the front end before you turn it into be shared. And so in basic, that's $1,500. And so the share in basics is going to be lower than our other program because you're bearing a little bit more on the front end. So that starts for an individual that's 18 to 29 at $99 a month. And then in classic or other programs for a family, it is $596 for a family of 7. And so even at $596, I've not had insurance now for 22 years. I've been with Samaritan. But 22 years ago, when I went to get insurance for just me and my wife, it would include a maternity rider. We didn't have kids at the time. It was $1,200 20 years ago. I've not shopped insurance in a while, but talking to some folks, I know that most insurance policies that are not subsidized are running in the 15,000 range if you have a family. So depending on the plan, it's probably going to be roughly a third of the cost of insurance with us if it's not being subsidized by the government on the marketplace.
I know that with your staff, you have trainings, you update them in everything that it's new, everything that is beneficial for your members. But what about your members? I heard you, and correct me if I'm wrong, that you have a newsletter.
Yes.
That you send. Besides the newsletter, what else do you do for your members to keep them updated, keep them members of your group, your ministry, and also train and teach others how beneficial it is to be members of this ministry?
Yeah. So the newsletter is probably the main way that we communicate with our members in terms of keeping them updated on how to be healthy, how other members are, dealing with healthcare needs. And then we also do a lot of conferences, especially one of the main connections we make is within the homeschooling community. Because we find that folks that are doing education differently or educationally traditionally outside the public school also understand this type of need bearing in healthcare. We also have a lot of other programs outside of the newsletter. We have a program where once a month we have some staff and some outside ladies that come in and they put together gift packets for members that have experienced miscarriages or loss of the child over that last month. Just send them a little something, knowing that we're praying for them. And these are by and large women that have gone through that experience themselves, and they really have a heart for that. We've, tried to help our members in disaster areas. So when hurricanes come, we're reaching out to them, explaining, okay, if you need to hold off on your share this month, because your house blew away or, your electricity's out, just, help us through that. And then if you need help from other members, in that, trying to connect those members. And then a few years ago, we actually even started a program that's now gone off on its own called the Morning Center. And that was it was fully funding maternity costs for those that would normally be on Medicaid. So those in the Memphis area is where it started, that needed help with maternity care. It was 100% prenatal and all the way to the birth, just trying to help out in that area and get folks, especially in that time of, where the church really should be helping with the birth, to get that folks off of government aid and just let the church help them.
Lots of ministries are under attack now in America. We have seen, Christianity being under attack. Are you experience any of this? Do you have anyone that was a member, is a member, and all of a sudden wants you to pay for transgender surgery or changing of sex or whatever situation that might be, or gay and lesbian being married? Do you have any situations like this?
So we try our best on the front end just to really help educate our members to understand this is not insurance. This is a faith-based, option to take care of needs. So fortunately, we have been so upfront on the front end. We've not really had to deal with that. I'm aware of one member, I want to say 4 years ago, that came back to us. That was in a same-sex marriage, asking, through our guidelines why this doesn't work. We walked them through the guidelines that they had signed off on, ahead of time, and resolved that. They ended up moving on, without any controversy. Really, probably the where we see the most pushback is really within the insurance industry or the government Department of Insurance, that really just see insurance as the only option. Want to, as many people as they can on their marketplace insurance, and they're a lot of times don't like any option outside of that. And they're pushing back on that, saying that, these type of ministries don't work. And, and that's where my role comes in, to explain to them, we've been, faithfully, our members have been faithful to each other for more than 27 years. And, and I'm proud to say that as far as we know, no member has ever complained to a government agency in our 27 years. And that is really, just God's grace that did that. I mean, for those that have insurance, they know how frustrating it is. And, I don't think there's probably any insurance company that can say they have no complaints to a government agency. Our members have concerns that they bring to us, and we're able to resolve those. But again, it's never, been taken to a government agency. And so that's also just a testament to our staff here, on the phones, being able to explain to our members, being able to resolve that in-house.
That is great. Would you tell our audience, our audience, everyone, where they can find you and look for the material, maybe become members?
Yes. So SamaritanMinistries.org. So SamaritanMinistries.org. That's a great place to start. You can read the guidelines there. There's a cost calculator, so you can figure out, the monthly cost depending on your age and which program you want to join. And then on there, there's the phone number to call. And if you don't find what you're looking for on the web, call. Our staff that's manning those phones, they are great, and there's not going to be a question that you're going to ask that they've not heard before. And I always tell folks, they're there to answer your questions. They're there to explain Samaritan. They don't want to sell you Samaritan. They're not on commission. They're not, agents. They're there simply to explain Samaritan to you and help you understand that the best you can.
Oh, thank you so very much. And Joel, thank you so much for being on our podcast and sharing with us so many valuable information that I hope people will take the time to go to your website and check out and see if that is something that will be good for them, for their family.
Yeah. Thank you so much for having me.
Well, thank you so very much, everyone, for listening to our podcast, taking notes, and hope you go to Samaritan Ministries.org and find out if that is something for you. I hope you will send us at the Courageous Leadership with Virginia Prodan your questions, your comments, and you will support our podcast, which is every Wednesday and Saturday at 10 o'clock Central Time on Spotify, Apple Podcast, Podbeans, Edify, and many other platforms. And of course, you can watch it on YouTube channel. We love to train you to be a strong and courageous leader, to do what God desires for you to do in life and live a life of significance and success, not only in your own life, but in the life of many. If you have any questions, please go to virginiaprodanbooks.com/contact. You can find there everything that you want. Until next time, God bless you and see you later.